Senator from Clark.
Speak on the measure, Mr. President.
Please proceed.
You know, I don't know that I looked at this bill several times. I'm a co-sponsor of it. I don't see anywhere where this bill mentions COVID-19, and somehow that's where this discussion has become. I know the minority party would like to make it about that, but I think it's important because often when we talk about regulations, particularly in health and welfare this past interim, I've expressed my frustration about how this administration has been using the emergency regulatory process. And I think sometimes the press doesn't like to cover this, may not make for the best headlines to be reading the newspapers or watching on television. This is the proper forum to cover some of the regulations that this administration has decided to pass this past year. And it's important to note the date of some of these regulations, because many of them preceded COVID, and they're political in nature. Not from this body, but from this administration down on the first floor of this building. The first one I'd like to talk about is 895 KAR 1002E, which is an emergency regulation, which is the repeal of the Kentucky Health Medicaid Waiver Program. That was filed on December the 27th, 2019. Nothing to do with COVID. It preceded the state of emergency in this state by several months, preceded the last session that we were here. But this emergency regulation was filed again in December, and while it's no surprise that the Kentucky Health Medicaid Waiver was not going to be implemented under this governor, repealing these 11 administrative regulations through the emergency regulatory process abused the emergency regulation process for the following reasons. Ultimately, it states there that this administrative regulation is needed pursuant to a certain date because it prevented a loss of federal and state funds. But the cabinet withdrew the entire waiver program prior to that, so there were no funds to lose. They also stated in their testimony to the Administrative Regulation Review Subcommittee that this emergency repealer was needed to prevent state funds from being used towards litigating this waiver in federal court. Yet we know that this cabinet wanted it gone, had no intention of litigating it, so therefore it was a moot issue. Again, it exceeded their intent of the emergency regulatory process. It's an abuse of using this in place. 900 KAR 5020E, which was a state health plan. This was an emergency administrative regulation amending the state health plan to influence the outcome of an ongoing administrative hearing regarding a certificate of need application for an additional ambulance service in Warren County. We know that's been, for those of us on health and welfare, we know that's been a hot button issue for a long time. And the bottom line is that this amendment was filed, again, early in the administration prior to COVID to fulfill political favors and promises for a hospital that was opposing this application. And regardless if you agree with the policy in this regulation, there's no doubt that this administration abused the emergency regulatory process for political purposes. Medicaid copays, 907 KAR 1604E. This is another emergency administrative regulation which removed all Medicaid copays, which are required by law passed by this body in KRS 205-6312. The emergency administrative regulations exceeds the cabinet's statutory authority. They effectively tried to change our state law through an e-reg system. And if it hadn't been for the senator from Bourbon pointing that out to say this is illegal, they went ahead and changed their ordinary regulation process, but not the emergency one, which basically effectively took away all copays. They've changed the ordinary reg, but again, an abuse of a system to achieve a policy decision. 921 KAR 3025E, which is food stamps for deadbeat parents. Ultimately, this is an amendment to this regulation that allowed non-custodial parents who are delinquent in court-ordered child support payments to be able to get food stamps and SNAP assistance. Not the children, mind you, the deadbeat parent. This was found deficient by our committee, and yet it was implemented nonetheless by this administration for a policy decision. Is that having to do with COVID? I don't know how it is, but nonetheless, that's how it got done. And you've already heard about the child care requirements mentioned by the Senator Bourbon, where they've had the same e-reg filed time after time after time. Emergency regs were meant to help allow us to maintain federal funding for particular issues or for a 30-day period of time, not to have one word change and have it reissued time after time after time. And that's what's been happening with this administration. We have a problem. Ultimately, that is that the executive branch agencies misuse the current emergency administrative regulation process in order to put into place a policy that they want immediately, rather than the true nature of an emergency status. And this bill, frankly, provides a solution to that problem. So you have to ask yourself, do you believe that the emergency administrative regulation process should be reserved for legitimate emergencies, rather than a forum for agencies to immediately implement their own policy agendas and fulfill political promises? If you think it should be used for legitimate emergencies, you'd support this measure. I don't know how the governor can justify pursuing regulatory measures that blatantly conflict with KRS measures and statutes that we have passed in this chamber, and even keep these regulations into effect even when it's brought to the agency's attention that they've exceeded their statutory authority. Another problem, emergency administrative regulations cannot be amended based upon public comments or legislative feedback. And this bill provides a solution to that in which it allows for that to be heard. If you want to have an amendment to the emergency regulation, what they'll often do in this, what we found from the cabinet and from this administration, they'll issue an emergency reg, put out the hearing so many days out, and then claim, well, we can't amend it, we don't have the ability. That's what we've heard in our committee and in private conversations. This bill allows them to amend those emergency regulations as well. So we clearly have a problem. We have an abuse of a system that we found in this state. And this is a good bill, and it's written well to provide an opportunity to amend, to hear public commentary, and to disallow an abusive system that's been done, unfortunately, by the cabinet and by this administration. And I would urge all members to vote yes. Thank you.